Hello, everyone. The title of my presentation is Enhancing Women Leadership at Makerere University College of Health Sciences, Lessons for Scale-Up and Strategies for Sustainability. My name is Suzanne Kiwanuka. I am a senior lecturer and a health system specialist, and also the head of department, Health Policy Planning and Management at Makerere University College of Health Sciences, School of Public Health. I am also a board member for AFENET and a mother of 4 lovely young people. So my inspiration for this project, which falls under the stream of catalyzing women leadership pathways, is that in February last year, I had an encounter, a conversation with a professor who I deeply respect. And while I excitedly told him about the increase in women leadership at the university, he told me that women are not ready for leadership. I must say I was deeply offended by this statement, but I decided to mull over it. And when I did, I decided to investigate and interrogate the actual women leadership within the university. In so doing, I found that only 404 of the 1,092 academic staff at the university were women. And of those, only 19% are at the rank of associate professor or professor. But in administration, about 50% are female, meaning that there is a systematic bias within women representation in academia. At higher levels of decision-making, committees and senior administrative positions, I found that female representation was at 17%, and its lowest within the STEM colleges. So my project background, what is Makerere University? Makerere University was established as a male-only technical college in 1922, and its motto was, "Let us be men." In 1945, the first 6 female students were admitted, but these were admitted on a separate curriculum. So since then, Makerere, which is currently at 100 years old, has instituted gender policies and strategies to boost women inclusion and representation. These have included the gender policy, the gender equality policies, strategies such as gender quotas and targets, gender mainstreaming and affirmative action, and so many others. But how have these enabled the university to achieve this gender equality? Gender equality has been slow at Makerere University, and female staff have been disadvantaged and stuck at lower levels because of deeply entrenched structural and gender-biased belief systems, which still hinder the possibility of women successfully obtaining leadership and decision-making positions. When I looked at the College of Health Sciences, which has 5 schools, I found that 3 of 5 deans are female, which is encouraging, and 10 out of 28 are heads of department who are females. This is actually a lot of improvement, but it does not cut across the rest of the university. Still, when you look at this kind of progress, can it be sustained? Do we have enough women who are eligible in waiting? Are the policies enough to actually help the university to achieve this gender equality? And most of all, are the females ready to take their place? So my project is looking at how we can make the woman ready to lead. I would like to do a situation analysis to look at who is there within the different departments in the university, and starting with the College of Health Sciences. Where are they? Who are eligible for leadership? Because they have to be at a certain rank. What are their leadership goals, their needs, their constraints? I would like to drive a data-driven leadership, advocacy, and leadership development strategy, which would include mentorship for the women, network building, leadership training, with the goal of scaling up the women leadership success from those units which are performing well to the rest of the units in the department and in the university. And these would be monitored by tracking eligibility, tracking leadership training, tracking the leaders in waiting, as well as the leaders in post, to drive them to look at how sustainable their leadership is. I am hoping that my project will make a leadership impact for sustainable, equitable women leadership at Makerere and beyond. So my call to action is, we need to make women ready. We might celebrate the progress made by women in academia to enter leadership positions, but we need to intentionally plan for sustainability. That means that in order to catalyze women leadership in academia, we need to be more intentional. We need to be strategic. We need to be inclusive so that we can attain that sustainable, impactful women leadership that we seek. Thank you very much for your time.